My name is Dr. Kamalendu Malaker. I'm a professor of clinical oncology, and I've been working as an oncologist for nearly 50 years. I started my training in Oxford and at the Royal Postgraduate Medical School in London, and then I worked there in the Hammersmith Hospital, and then Cancer Care in Manitoba, then the Harvard Medical School, and then many other places I've worked in a very senior position. We had to find out what we're doing now and what we're doing right and what we're not doing right and how we can modify the same things without changing much. So what's happening now, you see, the cancer treatment is skyrocketing. There's no question, and I don't want to spend much time. There is cost of cancer treatment has gone up by 10, 20-folds depending on which country you're talking about. The incidence of cancer is also rising globally, and it is actually extending to an epidemic portion in some countries, particularly like countries like United States, and also very poor countries like Uganda or Kenya. Now, in 2014, there were 14.1 million people who were diagnosed to have cancer. But it is estimated that by 2030, the number of expected cancer patients will rise to 23 million. It is a huge rise. You can see that there is from 1990 to 2017, I think, yes. In 2017, every age group that in cancer, the incidence has increased, particularly the age between 50 and 69, those who are at the top of the working life. But every age group, from pediatrics, from children to older group. But the highest rise is the older people, between 70 plus years old. So the cancer is rising, and you can see the figures, the green showing how it is going to rise between 2012 and 2035. The green is the world, and then the red is the less developed countries, and the blue is the more developed countries like the United States. But it is rising. There's no question. In every country, cases is rising. And this is a very interesting dynamic picture. You can see that what is happening between years. If you could raise the slide a little bit, you can find from 1990 till 2015, you see the color changing for every country. And if you go back and see, just concentrate on, look at Canada and India. Is blue, and then as with time, 1999, 2000, 2, 3, 4, 5, 6, 7, 8, 9, 10, and time goes on. And by the time we are at 2017, you can see the colors deepen in every country. And somehow, and we can even countries like Brazil, which is not a highly developed country, but their cancer is increasing so fast. And this is the comparative between 2017 and 1990. What happened between the entire globe? How the cancer incidence gone up in every country. No country is spared. So this is the kind of visual expression of the geographical distribution or geographical incidence pattern in cancer in the world. And I was presenting this one in Malaysia. I was presenting this paper in Malaysia, so I just got the Malaysian incidence. You can see the incidence of cancer in Malaysia between 1990 and 1917 is really gone by more than 60% in 30 years. And this is also dynamic. You can see what's happening, how the breast cancer, colon cancer is rising between 1990 and 2017. Every cancer is increasing. So that gives you a dynamics picture of what's happening in the cancer incidence. And this is particularly in Malaysia, but I've similar kind of dynamics of almost all the countries. So the treatment cost has increased exponentially, particularly in last 15 years. By 2020, the global cost of cancer treatment will reach between 150 billion, close to 150 billion USD. This will continue to increase by 7 to 10% annually. I can think what's going to happen by 1930, 35, or even 50. 60%, unfortunately, 60% of the cancer that occurs in low socioeconomic countries. However, only 5% of global spending is directed for these poor countries, socioeconomically disadvantaged countries, although they carry the 60% of cancer burden in the world. So what the real cost of cancer? What actually involves in the cancer expenses? In monetary terms, it is between 8,000 to 80,000 USD, depending on which country. But it depends on which organ is affected, the stage of cancer, when the cancer is detected, whether early, major, advanced, or critical, the kind of brand of medicines the doctors or hospital opt to use, the number of chemotherapy cycles and radiology or imaging tests which are required or used, nature and cost of hospital which the patient or the doctor opted to admit, and the doctors and oncologist fees, the duration of entire cancer treatment, extent of insurance coverage already available, if not, that's too bad, and also the loss of income that also affects the cost of cancer. And so after that, what happens when the cancer recurs, then the cost is just unbelievable. So these are the factors which, in the end, keeps up the entire cost of cancer care. So the cost, the drug prices are all increasing, and in 5 years, you see that the cancer medicines, they have increased by almost double. Is it from 2011 to 2011 to 2015? You see that the cost of cancer drugs has increased so much, and also because of the newer invention or newer understanding, one can see that the number of cancer drugs in clinical development have also increased by 63%. Or now at this point in time, even more. The reason number one and two is that there's PD1 and PDL1 checkpoint inhibitors. These are the so-called immunological immunocomprehensive drugs. They are very, very expensive. They're expensive because of the many reasons, but they're expensive indeed, and they do work. And we are tending to use it more and more in many more diseases. And this has got showing that how over the year from 2014 and 2018, how we have actually started using the more and more expensive drugs. From 200 units to we're going to 1,800 or 1,700 dollars. Just unbelievable. That is what it is. That is the life is now. That is how expensive it is now. How do you think that countries like in India or African countries can afford to expect can afford this amount of medicine for cancer treatment? So by 2030, 21.6 million people will be diagnosed with cancer, and of this number, 12.1 million people, 62.8%, will require radiotherapy. I'm talking about India. This is the kind of middle of the way country. India, the combined cost of surgery, radiotherapy, chemotherapy, and also nowadays including immunotherapy, it can cost. It used to cost 400 to 3,000 US dollars per treatment cycle, and the treatment cycle is one that 400 to 3,000. but normally it is 6 to 8 cycles. That means is 2,400 to 24,000 US dollars. 2,400 is well above our individual per capita annual income. How how anybody in India can afford to spend exactly what we try to achieve by prescribing the modern treatment? It is impossible. But in developed countries, I'm talking about here in India, but we talk with same kind of treatment in United States, that will cost you 10 times, something between 10,000 to 100,000 USD, even not more, depending on what kind of equipment you are using. I'll talk about the equipments in a minute later on. Thanks. Go on. It's very difficult to find out exactly what is the cost per treatment. You ask anybody, as the hospitals, as the doctors, as the government institute, we just cannot get a proper figure from anywhere. So I've been frustrated. I got patients telling me this, hospitals telling me this, drug companies are telling me that. So I cannot give you a real actual cost of treatment, but it is high. There's no question. So the technology, as that is another important. Radiotherapy is used something between 65 to 70% of cases of cancer when they're diagnosed. The equipments are linear accelerator, which cost between 4 to 4.5 million USD. Cobalt units are nearly, people start to throw it away, but that is, I think, is the most important cancer unit. We should be bring them back and use them properly. We're not using them optimally. I will say why. And then, of course, the kilovoltage radiation are not much used nowadays, but they still have their place. They cost between $250,000 to $300,000. Brachytherapy, when we use radiation isotopes inside the body in the tissue, very effective, but it is very effective, but it is not cost effective. It's very expensive. But the equipment costs about 300 to 300,000, $500,000, and we need a CT simulator to find exactly where the tumor is and the treatment planning to give the radiation treatment properly and repeat the treatment from day-to-day basis. And to establish the radiotherapy center, we need a bunker for accelerator, which costs between $2 to $3 million. A bunker for telecobalt units is 1.5 to 2 million US dollars. And then for housing for kilovoltage is $500,000. Imaging planning costs about 1 million, and for brachytherapy housing to store the bacterial unit is $500,000. So these are not cheap. The initial cost is quite high, but in the end, if it is properly and with some vision used properly, that could be even very cost effective. So what are the reasons the radiotherapy, we know what are the causes. Now, what the reason the cancer cost, expensive cost is increasing? It is ever increasing because of complex and expensive technology. The increasing cost of chemotherapy and other systemic agents, increasing cost of managing side effects of new agents. The more and more complex medications are using, the more and more side effects are getting unknown to many of us, and the management is becoming more and more costly. Increasing cost of investigations, labs, and imaging, like mass spectroscopy, MRI, all this is becoming kind of standard tests, but very expensive too. Increasing cost of technical support with technologists. There, we need more and more highly trained and qualified technologists to operate the machines and operate the system. And increasing cost of salaries for oncologists, because the oncologist training period is not 4 years nowadays anymore. After 4 years, you have to do at least 2 years of fellowship, and if you want to do any further subspecialty, you have 1 year. So we're looking at 7 years of training to become a full-fledged specialist oncologist, whether it is medical oncology or radiation oncology. That is the trend in North America. I think we are all trying to follow North America. That is not always the best thing, but that's the way it is going, looks like. And the complex technology causes complex maintenance an increase in downtime due to non-availability of expert technical and engineering support. The more downtime it is, the worse the more cost becomes more, because our infrastructure cost is not getting any less. Our data is same. So the downtime is bad. Complex technology is high downtime. The high downtime is giving us extra cost of escalating cost. And also changing demography. The due to people are living longer and they are getting more exposed to risk factor for cancer, and they're getting more and more cancer. And particularly, that more and more people are living with cancer or living after cancer, and they are with the chronic lingering side effects from cancer treatment, because they're living longer, and we managed to make the cancer a chronic illness, and we have to deal with that. And so these are the reasons why we're making the cost of cancer is escalating over the years.